The chair lays out House Bill 3703 and recognizes its sponsor, Senator Campbell, to explain the bill. Senator Campbell, I understand there is a committee substitute.
Yes, ma'am.
Senator Campbell sends up committee substitute. The chair lays out the committee substitute for House Bill 3703 and recognizes its sponsor, Senator Campbell.
Thank you, Madam Chair. Good morning. Good morning, members. You know, in 2015, the legislature passed the Compassionate Use Act. And this program was one that enables doctors to prescribe medical cannabis or CBD oil with low 0.5% THC to patients who suffer from intractable epilepsy. For many patients, participation in that program has been life-altering. Patients who have had hundreds of seizures a day, now after using the 0.5% THC CBD oil, are now living normal lives and graduating at the top of their class. And we have Julie here with us today that I'm sure will testify. But who are these people? Who are these patients? They're our friends, our family, our neighbors. Even, as I said, some that you'll see later. Chairman Colcourse, I think it was your page, Julie, that I met, that's here today. Members of our churches and in our communities. Committee Substitute House Bill 3703 expands patient access to the program by expanding specific medical conditions which can be prescribed CBD oil. These are epilepsy, seizure disorders, multiple sclerosis, spasticity, incurable neurodegenerative diseases like Parkinsonism, Huntington's chorea, ALS, terminal cancer, and autism. This substitute also reduces the onerous requirement of having to go through 2 neurologists to prescribe CBD oil, down to now 1 board-certified licensed specialist. They have to be working in the field to take care of the types of patients that have the diseases that I just described. The doctor has got to be actually treating those patients. DPS will still have oversight, including weekly inspections of the state's 3 licensed dispensaries, and the bill keeps the 0.5% cap on THC that we established 4 years ago. Members, at the end of the day, the bill is about allowing doctors who are board-certified specialists to treat patients who have been shown to benefit from this medicine. You know, today, I'm not sure, is Blake here? Okay.
He was in the ER yesterday.
All right.
This morning.
You will hear testimony, I think, from the parents of Blake Novacek, and I bring him up today because on Wednesday, you know, we were still trying to work on the details, so we couldn't lay this bill out in Health and Human on Wednesday. But Blake Novacek had come down with his parents to testify, and he's someone who has a traumatic brain injury. I hope you don't mind me saying that.
No, please.
Traumatic brain injury, and has multiple seizures, has breakthrough seizures. So he's on medicines and breakthrough seizures. Actually had one outside the gallery, you know, the other day, here to testify. And this will cover seizure disorders such as that. So with that, members, happy to answer some questions. You'll hear lots of testimony. But thank you so much, Senator Colcourse. You've worked with me on this to try to get this set up and working with patients and bringing folks in that this will help. And I thank you for that, Senator Colcourse, Chairman Colcourse. So with that, I welcome testimony. There's probably a lot of friends here that are going to testify on this bill. And I do have 3 other committees, so if I have to leave, just excuse me, please.
I had explained in opening, we were 5 minutes late in opening because I was running around the building in different places, but members will be coming in and out during your testimony. There's a vote in finance at 9 this morning, and then, but Senator Seliger is going to conduct.
And I have a question for him.
So,
yes, sir.
We'll start with, I saw his light first,
okay.
Vice Chair Perry, and then we'll go to Senator Seliger.
Senator Campbell, I remember distinctly the day we got the first round of this started. It was so narrow with the particular type of epilepsy. So it's encouraging, one, to see research moving forward, and that's my question, I guess. We were able to add additional diseases and afflictions that this may help. So I guess the question to you today is, I guess we have a pretty active research, or robust research, to be able to continue to add these type of disorders with this.
There is a lot of research going on. There's research in Israel. There's research going on here. There's a lot of anecdotal. That does need to all be pulled together. But we decided to take the research component out.
No,
There is, going
I
forward,
understand
there
the
is.
scope of the bill, and my whole question is, and I'm encouraged by it, because we thought at the time when we did it that there was other uses and other afflictions that this would benefit from, and as we have this broad-based discussion about, marijuana legalization and stuff, we might can get there a different way.
Right.
And so, but I just thought you'd probably know that there's an ongoing research to include every year. I hope we get to come back and add another affliction that CBO has been successful. So thank you for the bill.
Thank you so much. I do believe that research, we know there are receptors in the brain for cannabis. I do think that at some point we will have research to back this up. It's kind of hard when you're passing something out there and we've just got white papers and anecdotal information. So I think we've taken a conservative approach, but expanding it, and we've got this sentiment to look at how we can truly allow compassionate use of something that has proven anecdotally to help a lot. Thank you. Thank you for that question.
Senator Sullinger.
Thank you. Senator Campbell, I knew a bunch of people in college that were engaging in this research, but I never saw any results.
Now, I'm not sure I'd call that research.
That's an important point. But I would draw your attention to paragraph 3 when it says low THC cannabis means the plant, and any part of that plant or any compound manufactures salt, derivative, mixture, preparation, rosin. Those strike me as decidedly different things, because it's one thing for a prescription to say that there is going to essentially be a pharmaceutical with X dosage or milligrams or things, but when you talk about plant, are we going to see a prescription that just says find whatever you can put in a bong?
No.
Would you explain how that's going to work? Because
there are 3 licensed dispensaries now, and they grow the marijuana. They take the part that they need to make the ratio between CBD oil and THC to come out with a measurable 0.5% THC.
And I get that, but
so that it's consistent, but we're not regulating what part of the plant they have to use in order to get to that.
So you're talking about part of the plant, but you're not talking about the consumption of the plant itself, but derivatives from the plant. And the reason I ask that is because when you talk about oils, rosins, preparations,
where is our light? Yes, sir.
You can
There you had it.
measure the dose, but just simply consumption of the plant, you don't know what dose your patient's getting.
No, and that's a very good point. That's why we're trying to, we're using it. This is a medicine. So it's an oil. No, it's not a plant. It is just, it's being formulated to be used, prescribed as a medication.
Okay.
So it's not any raw plant in any way.
That's the question. Thank you.
And that's a good point. Thank you very much.
Thanks. Thank you, Madam Chair.
So I think we'll go to our witnesses. I have a few questions. Senator Menendez, visiting.
Thank you, Madam Chair, and I appreciate you allowing me to chime in. I filed the bill in 2015, 2017 in this session, and I want to thank my friend Dr. Campbell, because I think having her as a medical doctor involved and engaged in this very serious issue is important. And you mentioned anecdotal. I will tell y'all something that I hope none of y'all ever have to go through. But 6 years ago, when the cancer had spread so far through my father-in-law's body that the doctor said he just needs to go home and you just need to help him rest in his final whatever time he has, the hospice people brought a gallon-sized bag of opioid narcotics. Gallon-sized bag. And so in his final days, rather than being able to interact and talk to his family, he'd either be in excruciating pain or knocked out. Here's someone who didn't drink, didn't smoke, and didn't want anything that was illegal. And so the thing is that I know that it's an issue that we can talk about because we know that people do use this plant recreationally. But there are a lot of people, law-abiding citizens, who won't access the benefits of this plant because it is against the law. And I can take you a step further. There are people with incurable diseases, conditions like MS and Parkinson's and Lou Gehrig's and ALS who are suffering every day and who leave and they go to other states and they try. And I have no shame whatsoever of telling you I've been in a dispensary in California for my wife. And you walk in and it's like a environment a little like a pharmacy, and you talk to the people and you tell them, what do you have that would help? This is what my wife has. She's on a fentanyl patch that would kill most normal people. She's on opioid narcotics. She's had 2 back fusions. But she hates the narcotics because they keep her in a mental haze.
She has.
And so, pardon me?
She has the MS.
She has MS, yes. She's had MS for many years. And when you get the right combination, and my wife doesn't smoke and hates to smoke and doesn't drink. So it's not about getting some altered state. It's about not being in pain and not being in a mental haze.
Well,
this is a serious issue.
Thank you for joining us today, and
Thank
we
you.
appreciate your comments. At this time, we'll call Julia Patterson, Dr. Ed Fox, and Jay and Amy Novacek. And Jacqueline Fuller. And if there's not enough seats at the front, then one will rotate forward. Julia, we start with you. And pull the microphone. The microphone's moved. So.
Hello, my name is Julia Patterson. I represent myself, and I'm testifying in favor of HB 3703.
From Brenham, Texas.
Yes. I just want to thank you, Senator Colcourse and Senator Campbell, for inviting me to speak today. And I wanted to thank you for the hope that you gave me when you passed the Compassionate Use Act. That was the best gift ever. On April 15th, 2008, I woke up as a normal kindergartner, but by the end of the night, I had been diagnosed with epilepsy and life-flighted and on a ventilator. My journey thereafter consisted of 4 surgeries, a strict ketogenic diet, and dozens of medication with terrible side effects. Before CBD, I had 200 seizures a day, lasting 15 to 30 seconds. This affected my grades and my social life. I couldn't play sports, I couldn't go to sleepovers, and my only time away from my parents was at an epilepsy camp. After CBD oil, I'm now 1 year seizure-free. I have my driver's license. Very proud of that. I'm a UIL Social Studies state champion, and I'm finishing the school year with A's in college courses and high school courses. My doctor told me at my last visit that I'm beginning to wean the 5 other pills that I take every day. I have a mentor who is a veteran and a grandmother who would be eligible for treatment under this bill if it is enacted. And I would give the access to hope for them in a heartbeat, but only under a doctor's supervision. That's the only way that it worked for me. And truly, I want others to have the same hope that I do, that I have. CBD is a medicine, and it should be regulated by a doctor. Thank you.
Good job.
Thank you, Julia. Great job. We appreciate you being here. Julia was one of my pages earlier on the Senate floor this session, so thrilled to have you come back today and
Thank you.
Wow.
tell publicly your story.
Madam Chair, just
Senator Zogel.
if I could say, that I think this bill is going to be fine anyway, because I think most people believe that the legislature should not stand between doctors and their patients. If we had a mechanism by which you could testify before the entire Senate, it would probably cut the debate time down by about half. Thank you for being with us today.
Well said.
Thank you.
If you would, state your name for the record.
Yes, I'm Edward Fox, MD, PhD, and I'm here to speak for HB 3703. I'm a practicing neurologist in the state of Texas, have been for 26 years. I'm president of the Texas Neurologic Society, an organization of over 800 neurologists in the state, and I run an MS clinic near Austin, the MS Clinic of Central Texas, and I'm treating over 1,200 people with multiple sclerosis currently. I've been involved in over 100 clinical trials on products for multiple sclerosis, none of them cannabinoids, because that hasn't been possible to this time. I've spoken in front of the FDA advisory committees about products that have been used, and I have been attending sessions on cannabinoids at the American Academy of Neurology meeting, and in another 2 weeks there's a 6-hour session on this at a national meeting in Seattle. And so I'm very familiar with the science of this, and I would like to speak to it as a true medication. One that requires dosing, one that requires monitoring, and it is by no means a medication for all. Multiple sclerosis is a very specific diagnosis. The other conditions discussed are as well. And not everybody with multiple sclerosis requires a product for these specific symptoms. But Senator Campbell, you asked who are the people here that we're talking about here in terms of the patients, and I would put it as who are the people who would want to prescribe this product. And I'll speak as a neurologist who sees people on a day-to-day basis where I am prescribing medications that unfortunately cloud the mind and prevent employment. And what I would like to do is see these patients be able to attempt a product that would not have that psychoactive impact on them, and to see if I can start lowering their dosage of other medications and keep them away from chronic pain management clinics where they unfortunately receive medicines that may help temporarily but in the long run decrease their quality of life. So in my training in medical school, Baylor College of Medicine in Houston, very early on, there was a lecture where one of the professors said, comfort, care, and cure. So I can't cure this right now, but I want to comfort and care. Thank you very much.
Well said. Thank you, Doctor. If you could state your name for the record.
Yes, good morning. My name is Jacqueline Fuller. I was born, raised, and currently reside in Round Rock, Texas. I'm here in support of House Bill 3703. Thank you all for your time and the opportunity to share my story. I was diagnosed with multiple sclerosis in January of 2014 at the young age of 24. I started to experience numbness and tingling throughout my whole body, but didn't realize how bad it had gotten until I was in the shower one day and could no longer feel the water on my back. I was quickly diagnosed with MS and began an oral disease-modifying therapy. While the treatment for my MS has slowed the disease progression, I still experience daily symptoms, including anxiety, numbness and tingling, severe fatigue, spasticity during cold weather, which leads to trouble walking, and pain due to damaged nerves, amongst other symptoms that come along. After hearing about the potential side effects of taking the CBD oil, I started for my symptoms, I began taking it commercially available about 3 months ago. Since then, I've been able to stop taking daily over-the-counter pain meds, so reduced Tylenol and ibuprofen intake. I experience less anxiety. My fatigue has lessened as I feel like I'm getting more restful sleep, and the nerve symptoms I experience, especially the tingling and numbness, have become better. Overall, I definitely feel like my general sense of well-being has improved, and I feel healthier and more like myself. Recently, I skipped 2 days of this dose, and I can tell you that I felt a substantial difference in my health and welfare. There is scientific evidence showing that cannabis derivatives can improve symptoms of MS. What I'm asking for is the opportunity to work with my neurologist, Dr. Fox, to find a dose that is optimal for my unique symptoms, and that I'm hoping that the CBD products available through the Compassionate Use Program might offer an even more effective treatment for symptom management. I respectfully ask the committee on behalf of all Texans living with multiple sclerosis to pass House Bill 3703. Thank you all for your time and your service to the state of Texas.
Thank you. Thank you. Thank you for being here. Sorry for your disease, but we're going to keep working on a cure, but as the doctor said.
I appreciate that. Thank you.
What were your 3 C's, Doctor?
Comfort, care, and cure.
Love that.
Yeah.
So the Novacek family, if you could state your name for the record, and if you would like to sit down, one of you could leave, Julia, and then, yeah.
Thank you.
Please.
I'm just so touched by your stories.
There we go. All right, state your name for the record and who you're with.
I'm Jay Novacek. My wife, Amy Novacek's by my side also. Thank you all for listening to our story, and good morning to everyone. You know, we deal with a lot of stuff every day, and it gets tough. And the stories we hear from other people is also incredibly touching. And so that's one of the reasons that we are here. And I'm going to turn it over to my wife, Amy, right now.
You know, 3 years ago, 4 years ago, we never thought we would be in this position. Our son was brutally attacked in a fraternity hazing attack, not mistake. He was hit with a baseball bat, fell over backwards, hit the back of his head on a marble slab, and now he has permanent brain damage on all front, side, and back left sides of his lobe. TBI and a plethora of other symptoms. He has been having seizures for the last 3 years. We knew cannabis worked. Legally, we would like to see it be used for him. Thank you, Dr. Campbell, for coming to his aid the other day. We were not prepared for that. Usually his seizures come at night and first thing in the morning. He was in the ER yesterday and also had a grand mal this morning. He is heartbroken. He can't be here to see each and every one of you and speak on his own behalf, so we are here for him. I can't tell you as a parent, and I don't have all the statistics and whatnot and the legal lingo, but as a parent, to go to sleep at night is very difficult because we don't know if our son is seizing or not. And Jay and I both will tell you every single morning, to know if your son is dead or alive is the most horrifying thing to have to wake up to. I can't begin to tell you. And so this bill is very important. It's important for our doctors to have options. We have tried over 50 prescriptions that do not work, and we need our doctors to have options. I am hopeful and prayerful that this does work, but if it doesn't, that they have other options. Thank you for hearing, and please, please, I beg you, pass this bill.
Well, thank you both for coming today, all of you for testifying. I can't imagine. And I'm so sorry about your son. Wow.
We're here to support the hazing bill too, but we need him healthy first. Because I love their stories. I want him to come back to you all in a few years and sit here and say what they've said, because what beautiful stories. But he can't get in a car. He did the other day to see you guys. The trip was too hard.
So, how old is he now?
He's 22. He was on scholarship at University of Oklahoma. And he can't go to school or work. He remains in his bed or his chair 90% of the time.
Madam Chair.
Ms. Novacek, I want to make one thing clear. That was not a hazing incident. That was an assault.
Yes, sir.
And don't be surprised one of these days if the discussion of hazing continues, that you may come back as a witness.
We will.
I want to be careful. I don't want to ask you to admit to something you don't want to admit to. But has your son ever been in a position where he has had anything that had CBD oil or derivatives in there? Don't go to admit to something that may not be legal or that you don't want to admit.
Yes, sir.
But if you don't mind, has he ever had access in places where it is legal?
No, he has not.
Okay. And what I was going to ask was did it make a difference at the time?
I don't know how to answer your question, but we do know for a fact that the cannabis has worked.
Okay. Your answer was better than the question.
Okay, thank you. I don't want to speculate, but we do know for a fact that it has worked for him, and he was seizure-free completely and pain-free with it.
Thank you.
Senator Campbell.
Thank you. Thank you for your testimony. Be sure and tell Blake I said hello.
I will. He wanted to see you normal and say hello and thank you for your help the other day. It was so meaningful.
Well, it was pretty timely, yet, you don't want that for me to show up, and he was here for this testimony. But I also want to let everybody know, our Lieutenant Governor also helped with this to, help us craft this so that we were trying our best not to have flaws or misuse. And so our Lieutenant Governor also I think did y'all meet him?
Yes, ma'am.
Yes,
We did.
He too heard your story, and he's been, he's so compassionate, himself about things. And so I just wanted you to know that there's so many of us that hear the stories, we know the stories, and we are very supportive. So thank you for coming, and tell Blake I said hello.
I will, and he says hello, and he says all of you, thank you for listening to us, because it is, he said, the number one thing in his life, and is his life goal right now, which will hopefully help him be somewhat normal so he can be a normal 22-year-old.
Absolutely. And our prayers are there, and our
Thank
work
you.
is there.
Thank you, and we appreciate every one of you and your service. Thank you.
Thank you.
Our prayers are with all of you, too.
Thank you.
You guys have an extremely tough job, and
Thank you,
we
Mr.
appreciate
Novacek.
what you do for the
It
state
is
of
tough.
Texas.
Thank you.
We appreciate that, and we thank you for your service and being the star and being a great person on top of that. It's really, role models are hard to find sometimes, and you certainly have been one. I want to recognize Senator Buckingham as being present, and I want to also tell y'all that all of your testimony today, sometimes when you're a mom and you're up here and your 16-year-old son's back home and maybe not studying as much as you want, and you get really angry about things, that y'all put everything in perspective today.
Madam Chair?
God speaks loudly.
Amen. Quick
Yes.
question. Does the bill that's before your committee, will it help Blake?
Yes.
Okay.
In there is just seizure disorder.
Okay.
He has a seizure disorder.
Okay. I just want to make sure, because
It
I
does.
understand that there's a committee sub before your
I
committee.
just laid it out.
I know.
This is it.
And you let it out this morning.
Yes, right
Okay.
here.
Okay.
And it's got seizure disorder.
Great. I just want it to be the best bill that we can have
Yes.
to help the most Texans.
Absolutely.
Thank you, Madam Chair.
Can I tell you, we're out,
Yes.
one of our service dog kids has been in a hospital for 4 weeks. He's got diabetes and cystic fibrosis. His lungs are collapsing and he can't breathe. And he had 2 options, to be in their cannabis study or their MSRA study, because he has MSRSA in his lungs as well. Obviously, he had to go with the MSRA. His mother would like the cystic fibrosis at some point to be added and an option to help him breathe, because he can't breathe on his own, and he's 16 years old and a baseball player.
Thank you.
Thank you. Sorry.
A little bit of housekeeping. So, Amy, you filled out this card,
Yes.
and Jay, Amy signed it, so you have to go fill out a card, and we're going to scratch Jay's name out, so you both
Yes,
have to have
ma'am.
a card.
She did most of the talking. Why do I?
My husband would say the same thing. Mr. Novacek. So, thank y'all so much.
Thank you,
Thank you
guys.
for our entire panel. Members, if you don't mind, because we have so many witnesses on this bill, we're going to go straight into testimony for this bill. And I know that Senator Campbell and I both have to step out at 9 o'clock for a vote. I'm going to call up the next panel and then hand the gavel to Senator Seliger. So the chair calls, I say Thalia Segalik, or Thalia, Gregory Fowler, Chelsea Garza, and Piper Linden. On deck will be Magra Rivera, Keith Crook, Jacqueline Finkel, and Amy Lee.
We will go from right to left. If you'll introduce yourself, who you represent, and you will have 2 minutes to testify. Yes, ma'am, please.
My name is Chelsea Garza. I'm testifying for my son, Cullen.
Pull that mic up a little closer.
Oh,
Just
sorry.
pull it on the table. Just move it closer to you. There you go.
No, it's really close.
Close.
Okay. And I'm testifying on...
Right into the end of the microphone right here so everybody in the room can hear you.
There we go. Do I have it now?
Yeah.
Perfect. I'm testifying on 3703. As I understand it, the substitute does not include Crohn's and colitis. Am I?
That is correct.
So my son was diagnosed with uveitis and ankylosing spondylitis, that is inflammation of the eye and a debilitating form of arthritis, when he was 7. Thereafter, when he was 10, he came down with a stomach flu that wouldn't go away. And it was not surprising, although it was disappointing, when he was diagnosed with indeterminate colitis. He is in the 10% of the 1.6 million Americans who cannot be classified as either Crohn's or colitis because he shows signs and symptoms of both. He went into a 10-month-long flare. That meant for him that he suffered with fevers, abdominal pain, cramping, nausea to the point that he wouldn't eat. His tired little immune system, at the end of that 10 months, he got strep throat. Totally normal for a 5th grader. But that turned into an upper respiratory infection, which turned into bronchitis. His thyroid failed. His adrenals failed. His gallbladder failed. He missed 46 days of school. He got to the point where he wouldn't sleep alone because he was afraid he wouldn't wake up. My 10-year-old wouldn't sleep alone because he was afraid he wouldn't wake up. You mentioned the cannabinoid system. There are cannabinoid receptors in the gut, CB1 and CB2. There are studies that have shown that medical cannabis, it induces and maintains remission with the same rate as the most prescribed medication for Crohn's and colitis. There is no reason to exclude my son and others like him from this bill. His doctors, his gastroenterologist, his ophthalmologist, his rheumatologist, his immunologist, and his pediatrician, they all work together, and they work so hard to keep him healthy, and I'm asking you to work together and to help my son.
Thank you, Ms. Garza. The clerk went to go get a Kleenex, and if you'll just stay right there.
And Mr. Chairman?
It's very valuable testimony. Thank you, Senator.
While we don't have everything in this bill, we started out trying to just let it be between a doctor and patient and whatever the problem was. But there's, we want to get what we can to get out. My daughter, too, has colitis. She hadn't gone through the things that your son has. But it doesn't fall on deaf ears, your request.
No, I understand.
Please know
My son spends so much time at the doctor's, tests, procedures.
Yes.
When he was at his sickest, he would lay in bed in a ball and moan in pain. For a parent to hold their child and be able to do nothing about it, that is devastating.
Well, just know we care, and someday, hopefully in the near future, there will be a cure for all of this. Thank you so much. Thank you, Mr. Chairman.
Senator
and
Menendez.
please excuse me, I've got to go.
Okay.
And before you leave, Mr. Chairman, I want to just say thank you for being here, because even though Dr. Campbell has tried, like I have wanted the bills to be whatever the doctor sees that need for medical cannabis, hopefully there are people watching your testimony who can understand that it needs to be a doctor, because we don't limit what other doctors do on other prescriptions, and we shouldn't on this one. Dr. Campbell is trying. I appreciate you being here, because everyone needs to hear, and you, as you testify, it's important that we hear what the need is, but also that you know that it's been proven that cannabis can help the condition that you're testifying in. Because I think there's a misconception that people just want to have it for whatever reason, willy-nilly, because they're afraid of what's happened in other states, that it's been abused. That's not what this is about. You wouldn't be taking time out of your day and be here if this wasn't serious to you and your family. Thank you.
This is the last thing I thought I'd be doing, and this is the last thing I thought I'd be asking for. But I know it works. The last time I was here, I brought a 14-year-old Crohn's patient with me from Oklahoma, and she sat down in people's offices and she talked to them about how it worked for her, about how she was like my son. She couldn't gain weight, she didn't grow, she couldn't thrive, she couldn't go to school, and now she's at the top of her class, and she's not here today because she has to get ready for finals.
Yeah, I wish everyone in this building could understand what you said. I hope we can get through to all the ears that understand this is a medical issue. very serious one. Thank you. Thank you, Mr. Chairman.
Senator, Ms. Garza, on this card, you want to testify on the bill. It seems clear that you want to testify in favor of the bill. May I have your permission to change the card?
If it includes my son.
It just includes the people who are actually testifying. But we know what your testimony is about.
What she's saying.
I'm saying I'm in favor of the bill if it includes my son. It doesn't include Crohn's. It doesn't include colitis. It doesn't include arthritis. I mean, he has a host of diseases to choose from.
I understand. Thank you. Yes, ma'am. Would you please give your name and who you represent?
My name is Piper Lundeen. I represent myself and my family. My son, Zachary, is 11 years old, a participant of the Texas Compassionate Use Program. Thanks to the Texas, well, I guess first of all, I want to thank Senator Campbell for working to expand this bill, and I want to thank Senator Menendez for working for so long for all of the patients in Texas that need access. So my son has a condition called ESES, where he has electrical status epilepticus. So he's having thousands of subclinical seizures in addition to, prior to cannabis, he was having 20 to 60 seizures a week. So with access to the Texas Compassionate Use Act and other things, we've been able to bring his seizures down to about 1 to 3 per week, and his subclinical activity is dramatically reduced. So a couple of the things that are concerning to me about the bill as it's presented right now are that as parents, we're forced to come up here. We have special needs kids. We shouldn't have to come up here every 2 years to fight for expansion to include our kids in these bills. It's unnecessary when physicians are way more qualified to look at research and determine what research, not all research is good research, for physicians to be able to look at that and say, this is valuable and we need to include, and be able to include these patients on this is vital to the health of Texans. And then the other thing is, for my son, we've experienced this dramatic reduction, and we have used high THC cannabis. It's been incredible, absolutely incredible in controlling his seizures, and we need more access to safe, consistent, higher THC in order to get his seizures in control. And right now he has difficulty in recovering from seizures sometimes. He isn't quick to start breathing again. He's had seizures where he falls face down on the pavement. I'm afraid that his whole face is going to be smashed in when I get to him. And so these are life-threatening issues still with the 0.5% THC that he's got access to.
May I ask you, because we've got a lot of witnesses, to please wrap it up.
That's it.
Any questions for this witness from the committee? If there are none, thank you for joining us this morning. Yes, ma'am. Would you please tell us your name and who you represent?
My name is Talia Segelink. I represent myself, my family, and Mothers Advocating Medical Marijuana for Autism. And a lot of our moms are here today with pictures of their kids, and they're choosing not to testify out of respect for your time. So I'm speaking for a lot of people, and that's a heavy burden right now. This is Lance. Lance is 14. He has autism. And we've been on the black market since 2014. I'm a conservative Christian Republican voter. I can't tell you what it feels like to be engaged in criminal activity. We've had CPS called on us. I was investigated for a month.
Can we hug Dr. Sam?
But I'm so glad we did this, because it was worth it, that month of hell, because before Lance was so aggressive. He would scream and hit and bite and pinch. He couldn't learn. He was, I was a prisoner in my own home sometimes. I would go to the grocery store at 6 in the morning so I wouldn't have to take him with me, because he would just reach out and hurt toddlers. He was only like 7 or 8 at the time, but he could really do some damage. And my daughter, his twin sister, couldn't have friends over, and I could go on and on, but I can't. 2 minutes isn't enough to tell you our whole story, and it's not enough to tell you the stories of these mothers, the broken bones, the children in facilities, the moms that are in TCUP, but the 0.5 isn't enough. And when we established TCUP in 2015, there were no clinical trials on epilepsy, not one. That number was a little bit arbitrary. And those doctors, medical professionals, Senator Campbell, Representative Click, Zerwas, Oliverson, they've all joint authored bills at 1% because the research is 1 to 5% for everything, for autism, for MS, for epilepsy. It's all 1 to 5%. The legislature looks like it can't read research to the rest of the country. We have the lowest cap on THC.
Thank you, Ms. Segelink. You've testified very well for all the moms here.
I'm sorry, so emotional.
Lance, is there anything you would like to say?
Lance, you want to read your part? Want to read your part?
Some friends need oils to Texas. Can help friends get oils?
Lance couldn't read before these oils.
Okay. Thank you very much. Thank you all for being here today. Chair calls Gregory Fowler. Ms. Segelink?
Yes, sir.
Would you do a testimony card or have Lance do a testimony card, please?
I thought we did.
You did for yourself?
And for Lance, I believe.
Okay. Yes, sir. If you give your name and who you represent, Mr.
Hi, my name is Gregory Fowler, and I represent myself and my family, and also Tourette's Texas, the Texas chapter of the Tourette's Association of America. I was going to ask Senator Campbell, I saw this morning that neurodegenerative diseases like Huntington's and Parkinson's were added to the conditions list, but I wasn't sure if it included Tourette syndrome, which should be right in there with those. It's also a condition of the basal ganglia and a movement disorder treated by the same doctor as those other two. So I know she's not here right now to answer that question, but for our story, when my daughter was in like 4th grade, back in about 2011, one day she just started twitching her arm, and she would reach up and pull out a wad of hair and rip her hair out and to have bald patches, and she did that for a week or so, and it went away. And we talked to the doctor about it, and they said it was anxiety probably, and just to keep an eye on it. Well, long story short, about 2017, her motor tics were totally debilitating. She was hospitalized several times. One of the times when she was in the hospital for a 6-day stay turned into longer because Hurricane Harvey hit, and that doesn't have anything to do with her condition, but it was just a traumatic experience for us. So as the 2017 ended, we had tried all the medicines, mostly combinations of lorazepam and clonazepam and tetrabenazine, and all those have a side effect of suicidal ideation. When you take a young kid that's ostracized from their community because she couldn't go to school, her motor tics and her verbal tics were so disruptive that she was forced to be homeschooled, and also she used a webcam to go to school. So we started using the cannabis oil that we found out from the Tourette's Association, that in other states and worldwide this is becoming the new trend in treating Tourette's, because there are very few FDA-approved
If you would wrap
medicines.
this up, Mr. Fowler.
So just in the past 16 months, she's been on cannabis oil. She's been able to go back to school. She's got all of her motor facilities back. She's even begun to take guitar lessons, and she's back riding horses and doing everything that she would normally do. So I'd just like for y'all to consider and make sure that Tourette syndrome is covered in this bill. I know it's, like I said.
Thank you, Mr. Fowler.
Thank you.
Any questions for this witness from members of the committee? If there's not, thank you for being with us today.
All right. Thank you.
Chair calls to the table Myra Rivera, Keith Crook, Jacqueline Finkel, and Ann Lee.
Yes, ma'am.
questions.
Who do we not have here? Ms. Rivera? Myra Rivera. Maybe she may be in the overflow room. If she comes in, she will...
I'm not going to testify, so I'm sorry.
Okay. Do you have another one? How about Jason Vaughn? Mr. Vaughn. Did they all go with the chairman? Chase Bearden? Thank you all. If you'd like to start, please give us your name, who you represent, and you'll have 2 minutes to testify.
Certainly. Madam Chair and committee, Major Keith Crook, United States Air Force, retired. I'm testifying on House Bill 3703. I'm one of Senator Campbell's constituents. I'm a combat veteran and have been fighting PTSD for the last decade and a half. Before going to war, I was a special agent who specialized in investigating violent crime against children. So protecting weak and defenseless was my calling. It's all too easy to see combat wounds such as amputated limbs and horrible burn scars, but PTSD is unseen. Its resulting addictions, depression, violence, and self-directed rage do not appear is a typical wound. It appears as somebody to stay away from, somebody dangerous. Yet, since 9/11, over 130,000 veterans have committed suicide after their service in Iraq and Afghanistan. That's a casualty rate 20 times higher than combat, in case that means a difference. My story could be any one of theirs. Their story was almost mine. In 2003, I was ordered to Baghdad, underprepared and undertrained. Within half an hour of arriving, I was outside the wire on the first of 150 outside the wire missions in 90 days. I was shot at for the first time within 20 minutes. That was certainly not the last. I completed 150 combat missions outside the wire in arguably the most dangerous place in the world. And I learned the reality of war. It's ugly, it's horrible, and it's terrible. It requires good people do horrid things. I arrived in Iraq very secure in my calling to protect the victims of violence. I left haunted by the violence I committed, the protector no longer. Decisions I made in split seconds over 15 years ago haunt me today, and those decisions and guilt almost killed me. They would have, but for my psychiatrist, a Texas physician who risked her license and her career to recommend I try cannabis as opposed to the medications I was using.
Excuse me, Mr. Cook, Senator Menendez.
Very quick question, Mr. Chairman. I know we're running short on time, and first of all, let me thank you for your service.
Thank you.
And thank you on behalf of thousands of veterans who would suffer from PTSD and would like to be here. What happens if the legislature does not address PTSD in this bill? In your words, what do you think is going to be the impact?
I'm going to bury more of my friends because this medicine saved my life. And there are people who don't have the ability to access it or who refuse to access it because of a law. I'm a criminal. I use every day. Yeah. But I'm just trying to stay alive and do the right thing.
Would you consider it unjust that this current law does not allow you to use cannabis for your PTSD?
I most definitely consider it unjust.
Thank you.
Yes.
Thank you, Mr. Chairman.
Mr. Cook, would you tell us a little bit, when you came back from Iraq, what the onset of PTSD was like in its manifestations?
Yes, sir, I'd be glad to.
We won't have too much time, but I would like to hear a little bit about it.
Absolutely. I came back from Iraq changed. The first person to notice the change was my wife. She asked me to go and receive treatment. I started treatment. Unfortunately, she became terminally ill, and I stopped caring for myself. I had unaccountable bouts of rage. I slept no more than 2 hours a night without medication. With medication, and I'm talking double doses of Ambien, Halcyon, and Jim Beam, I could sleep maybe 4 hours a night. I spent 13 years living like that.
Okay, thank you.
Anger, pain, fear, isolation.
Thank you. Any other questions for Mr. Crow? If they're not, thank you for being with us today. Ma'am, would you give us your name, who you represent, and you have 2 minutes.
Hello, my name is Jacqueline Finkel. I'm here representing Texas Normal, which is a nonprofit that advocates for patient access, and I'm here to testify on the bill. I have given each one of the committee members one of these binders here, and out of respect for the committee members' time and out of the respect of all of the patients that couldn't be here today, we've accumulated this written testimony for you to review when you have a moment. Of note, I would point out Dr. Brian Adnoff. He's a retired distinguished professor of alcohol and drug abuse research at UT Southwestern with 30 years experience with addiction psychiatry in the Department of Veterans Affairs, and he's written a very thoughtful 2-pager with resources for you. You'll hear many stories like veterans, like Keith here today, and many of the veterans were up here yesterday visiting your offices requesting that you include their service-related disabilities. Some of those disabilities have been included, but I did want to point out that the current bill currently would leave behind those with PTSD, ulcerative colitis, and many other conditions that can be greatly benefited. We also dropped by some binders with 630 pages of resources and research on many of these different conditions so that you'll have the opportunity to review that research and hopefully consider adding more patients because Texas patients don't have another 2 years to wait. So thank you for your time. If you have any questions, I'm available.
Any questions for the witness? If there are none, thank you for being with us today. Yes, sir. Would you give us your name and who you represent?
Chase Bearden with the Coalition of Texans with Disabilities. Basically, we're for the bill, but there are some flaws that we see that really need to be addressed, and you've been listening to them. There's so many people that are not going to be covered, and also the 0.5%. There's times when we need doctors to be able to work within that and see ranges as research comes out. What we could put in this is similar to what Representative Lucio had put forth, a drug utilization review board. You know, we do it for Medicaid under our prescription drug programs where we have a group of doctors come in to decide which new medications, what are the levels, who will it treat, and work from there. That's something the state does to regulate our prescription drug programs. We could do something very similar to that, appointed by the governor, lieutenant governor, House and Senate of members and doctors that could sit down and address these issues, because the research is coming out. And there are a lot of people right here who, if they don't get into this program now, it's at least 2.5 years by the time we get to the next session and get through it. If that then passes, another 6 months to get to the point where they can get treatment. So what do we end up doing by just leaving it blank and not having a mechanism that allows the state and informed doctors and scientists to make a decision? Under the current rules that we already used for making state rules for a lot of our agencies, at the end of the day, the governor can not choose that rule to move forward. So we have enough protections. We have a mechanism. We just need you guys to put that in there. And I will end for myself. Y'all have seen me up here for over a decade. I've worked hard every day. For that whole time, I've been taking painkillers. It wasn't until 2.5 years ago I started working my way off them, because the next step was adding a fentanyl patch to all the hydrocodone they were giving me. I would leave these committee rooms, race back to my truck and take a pill, and then come back and sit till midnight. It wasn't until 6 to 8 months ago we went to Colorado, and you asked the question earlier, I'll tell you, yes, I got the oil. Mine was equal to 1-to-1. It had an equal amount of THC, and that's what got me off.
Any questions for this witness? Thank you for being with us today. Yes, ma'am. Would you give us your name and who you represent?
My name is Ann Lee. I'm from Houston, Texas. My late husband and I founded the group called RAMP, Republicans Against Marijuana Prohibition. It only took us 13 years to realize that alcohol prohibition did the exact opposite. Alcohol prohibition made it possible for kids to get alcohol, because a saloon keeper didn't have to have a license, could sell it to anybody. I ask you now, what license does a drug dealer need to sell your kid marijuana? Marijuana should be tax controlled and regulated like we do alcohol. I'm too angry. I am too angry to be reasonable. I admit that. This is a beautiful country. We were born with the birth defect of racism. Slavery within our Constitution when this country was born. And what did it take to get rid of that? A civil war.
Ms. Lee, could I ask you to restrict your comments to the legislation?
Well, I'm for this legislation. As I said, I'm really too angry to be rational right now. And I think that this is all should be unnecessary, except for the Marijuana Tax Act of 1937, which is bad law. We do have bad law in this country, and you all should do something to rectify that. Thank you.
Thank you, Ms. Lee. Any questions for Ms. Lee from the committee? Thank you, all of you on this panel, for joining us today. Thank you. Chair calls Jason Vaughn. And Sean Meredith, John David Carrasco, and Jennifer Ann Kimbron. Who are we missing here? We have Jason Vaughn, Sean Meredith, John David Carrasco, Jennifer Ann Cambron. Is she here? Okay. Do you have anybody else? Dr. Jordan Amadio. Dr. Jordan Amadio. If I'm mispronouncing it, A-M-A-D-I-O. Tracy Ansley. Is Tracy Ansley here? Thank you for joining us. If you'll go down to the end, please give us your name and who you support. Keep an eye on the lights, and you'll have 2 minutes.
My name is Tracy Ansley. I'm representing myself. I'm also representing Texans who are living outside of the state. I have many friends that have had to move to get access to medical cannabis. The Bortels, the Procs, the Harmons, the Walkers. How many more people am I going to have to watch leave? And now they can't come back. You know, what about Texans that are having to live outside of the state as refugees that would like to come back and visit their family and friends, but they can't? Why is it a zip code? Why are we limited to medical access to CBD and THC by zip code? I also have many friends that have passed away that have come up here with me for over a decade. Teresa Garcia, Vincent Lopez, Lisa Solis, and Holly Plant. I'm losing people, and I need your compassion. I need your help. And that's all I'm asking for today.
Questions from Ms. Ansley? If they're not, thank you for being with us today. Yes, sir. Would you please give us your name and who you represent?
My name is Jason Vaughn. I'm here representing myself and Texas Young Republicans as the policy director, and we are for the bill. And you've heard a lot of emotional testimony this morning, and it's to sit here and speak. It's which way do you go? I can stand here and talk about all of our members who are desperate for this medicine for their children, for their spouses, for themselves that are leaving the state, that they can step in to any state around the Texas border, even into Mexico, and they can have their medicine legally, but they can't be in the great state of Texas. But honestly, at this point, I understand my friend Ann Lee's anger and frustration because, she spent the last 20 years with her son in exile because her son can't get the medicine he needs here. And she turns 90 years old on September 8th. And so on September 1st, this bill would go into effect. And I'd ask you, she's been a Republican conservative icon in Houston for decades. What a better birthday present to give to something like her, to someone like her. I watched my mother. I lost my mother my senior year of high school, mentally, not physically, but because she had cancer and got addicted to opioids and was working at a pharmacy, which is a really bad thing to have an addiction to opioids when you're working in a pharmacy, and created her own little Ponzi scheme. Now she got very lucky and was caught and came out of that and everything, but this would have been something that could have greatly helped her. And so and at the same time, watching my grandmother die of cancer, how many people do we have that are literally dying, have no other option, when we won't even say you have the right to try something like this? We're in a great need. There's pain, there's anger, and you guys have a great opportunity here. I'm tired of asking for crumbs. I'm tired of standing before you and asking for that. You have an opportunity. Dr. Campbell has a great bill, had a great bill, and I'd ask you to substitute that for this, and let's get something actual done for these people. Thank you.
Any questions for Mr. Vaughn? Thank you for joining us today. Would you please give us your name and who you represent?
My name is John David Carrasco. I'm President and CEO of Can Live, and also I represent the Texas Hemp Business Alliance. We're a group of businesses in Texas, including attorneys, doctors, medical professionals, realtors, financial advisors, that are pulling their resources and knowledge together. From a personal perspective, I started this company in October of 2015, understanding what cannabinoids do for the human body after my father's passing of colon cancer. At that point, I started testing CBD from industrial hemp, specifically myself. After being on pain medication for over 10 years, I was able to completely stop all opiates and also completely stop smoking after 10 to 13 days. That forced me to rethink my complete career, started a company, Can Live. We then, in October of 2016, met with a group of researchers as we were touring the Johnson & Johnson labs. We started discussing the effects of cannabinoids on certain cancer cells, and we began testing. In fact, Representative Click and I sat in and saw preliminary research findings of how cannabinoids affect lymphoma cells, and the research is there. It's very exciting. We've been quietly researching how these cannabinoids affect various different types of cancers over the last 2 years. And also in conjunction with that, we've been working with multiple sclerosis groups throughout the state of Texas. Just this last year, out of Dallas, the Yellow Rose Gala Foundation raised over $230,000 for multiple sclerosis, and we're now working with their research team to develop a research program to expand that into cannabinoid research. Currently, we're in the process of raising $10 million for a 5-year program for research programs here in Texas. Today with me are my attorneys, one from Houston, Mark Metz, but also an interesting occurrence is we have an attorney here from Ecuador who is wanting to see exactly the process that we're going through here in Texas to take that knowledge to South America.
Thank you, Mr. Carrasco. Any questions for this witness? If there's not, thank you for joining us today. Yes, sir. Would you please give us your name and who you represent?
My name is Sean Meredith, and I'm representing myself. I'm here in support of House Bill 3703. In 1984, I was in a construction accident and suffered a spinal cord injury when I broke my neck. A typical Monday morning turned into 5 months of hospitalization, operations, medical complications, and rehabilitation. It also left me with a lifetime of pain. 3 days before my 21st birthday, I was released from rehab, and I went home with a big shiny chrome wheelchair and a basket of pharmaceutical drugs used to control the intense muscle spasms and to reduce nerve, muscle, and joint pain associated with my injury. Many drugs used in spinal cord injury management have horrible side effects. We all know about opiates. Baclofen is used for spasticity, also has terrible side effects. Using all of these medicines left me in a lethargic haze. I soon realized that my recovery was being hampered by using these drugs and the numerous side effects associated with them. A medical professional in the rehab facility I was at kind of took me off to the side and said, "It's a group over there, you may want to talk to them. They have something that's natural and safe and may help you out." So I did some research, found that cannabis had an almost instant effect on reducing spasticity and a lot of the pain. Spasms don't really sound like much, but I've had them throw me out of the chair. They started a series of events that ended up with me breaking my leg. They're also embarrassing. Knocked over a table at a hotel having breakfast with people. Just my body just decided to straighten out all at once. It knocked a whole table over and all the stuff went everywhere. So cannabis is a safe and effective alternative to a lot of prescription drugs used to manage spinal cord injury. People shouldn't face criminal penalties for choosing a natural medicine. I'd also like to see this bill be more inclusive because this medicine works for many things: PTSD, autism, etc.
Thank you, Mr. Meredith. Questions from the committee for Mr. Meredith? Thank you for being with us today.
Thank you.
Could I add one more thing?
Yes, ma'am, you have to identify yourself
My
and who
name
you
is
represent once
Tracy
again. And
Ansley.
please speak into the microphone.
My name is Tracy Ansley, and I'm representing myself again. I would like you to know that I have systemic lupus and rheumatoid arthritis. Normally, I treat myself with a 1-to-1 ratio of CBD to THC. Today, I took Robaxin and oxycodone that's prescribed to me, and I am much, much higher than I've ever been on cannabis. And I'm very uncomfortably high right now on prescribed pain medications.
Thank you, Ms. Ansley.
Yes.
Chair now calls Jennifer Ann Cambron, Dr. Jordan Amadio, Robert Marks, and Rene Perez. Right now we have Jennifer. If you will...
I'm sorry, I am Rene Perez, and I will not be testifying. I've changed my mind at the last month.
Okay. Thank you. Will you please give us your name and who you represent?
Yes, sir. My name is Jennifer Ann Cameron. I represent myself, and I'm speaking on Bill 3703. My background, I am a United States Marine. I served over 9.5 years, 4 combat tours, 2 to Iraq, 2 to Afghanistan. I'm speaking from experience here and on behalf of many veterans. I not only served, my older brother served as 100% disabled with PTSD. He has 4 children, and it greatly affects the family, not just the individual. I know that part of this bill mentioned veterans, and I believe it's been taken out, and I would hope to see more support for our veterans and for family members, and not only veterans, but also anyone with opioid addictions, because I think there's probably not a person in this room that hasn't been affected by the opioid epidemic. It touches not just the poorer families, but also the wealthier families. I've lost friends to veteran friends from suicide after being, prescribed them by the VA, overprescribed. And Texas now is tied with Florida with the most suicide veterans in the country. And I would like to see that change, and I think that cannabis could do that. Cannabinoids, the oil, and THC as well. I also would like to push for more research into this and the expansion of putting that in the bill and expand more on research and also regulation. I don't think there's enough regulation when it comes to CBD. I believe that, and studies have shown that a lot of them contain heavy metals, and even in general, we're giving these drugs to our children, and we need more regulation there as well.
Mr. Chairman.
Thank you.
Just to
Senator Menendez, please.
Thank you, Mr. Chairman. Just to clarify, what you meant was that the CBD that's currently being sold, people don't know what's actually in it.
That's correct.
Yes, because so what you're asking for is that if we were to do something, that we would test all of the CBD that's being sold so that people would know what they're actually buying.
Yes, sir.
Yes, and I think what you were defining and what you'd like to see was the original bill that Senator Campbell had to help veterans with PTSD. Was that correct?
Absolutely.
Yes, thank you for your testimony.
Thank you, and thank you, Senator Campbell.
Would you help us understand a little bit, in your brother's case, what 100% disability with PTSD does?
Yes. It's a lot of the times it's much like depression, and he would have flashbacks. So some days he would just be in bed. His wife doesn't work; she's a stay-at-home mom. When you have 4 kids, it's easier that way. And he has to get up for his family, and it would just take a toll on him. I mean, I've seen him age, and just a few years. He's tried almost every antidepressant on the market without. He doesn't live in Texas. He lives in another state where he can take CBD oil, and he hasn't taken an antidepressant since he's taken CBD. So it kind of has helped him get back his home life, like his family life. He and his wife separated for a while because he just couldn't deal with everyday life, and obviously that affected the children. So.
No, that's fine. That's a good answer. Thank you.
Thank
I
you.
was going to say it sounds a little bit like living with my wife, but
I believe my boyfriend would say the same about me then.
Thank you.
Thank you.
Yes, sir. Would you please give your name and who you represent?
My name is Dr. Jordan Amadeo. I'm representing myself. I am a practicing neurosurgeon at University of Texas Del Seton Medical Center. I underwent my training in neurosurgery and neuroscience at Harvard Medical School, followed by Emory University in Atlanta. I now see patients with brain and spinal disorders here in Texas. Due to my relationship with the VA, I also take care of many veterans who suffer from degenerative spinal disease, chronic pain, and comorbid conditions such as PTSD. I think this bill is an opportunity for Texans. I'm speaking on the bill. An anecdote from my practice is that I recently had a patient who was actually a veteran who needed spinal surgery, spinal fusion, due to severe incapacitating pain. This gentleman had nearly lost his job on behalf of the pain. He was completely in a state of depression and despair. After the surgery, he did very, very well, regained his quality of life, and came back into my office thanking me for the surgery and said, I attribute my recovery and being off opioids completely within 1 week of surgery to the use of CBD. And he said, Doc, you've got to do something to make this available to your other patients, because I'm telling you, this has changed my life. Now, in medicine, we have a saying: the plural of anecdote is not data, and I agree with that as a scientist, which is why we need the data. We need light shined on this matter to be able to perform the research, to be able to treat the patients, and to collect data and create evidence-based guidelines around the use of these medicines. The bill is excellent. It could go further. We need to expand the indications to things like chronic pain, opioid use disorder, PTSD. We should preserve the sanctity of the doctor-patient relationship, expand the types of physicians who can prescribe this medicine or recommend it, such as neurosurgeons, and promote research. Thank you for your time.
Thank you. Questions for Dr. Amadeo? If there's not, thank you for being with us today, Doctor. Yes, sir. Would you please give us your name and who you represent?
My name is Dr. Robert Marks, and I'm a pain management. I represent 28 million Texas patients, which include all of you, all of us, everybody behind me, as well as the Lieutenant Governor and Governor, because all of us might need this one day. To be clear, I have zero financial interest in cannabis in the state of Texas. I could care less if this is legalized from a personal standpoint. I'm dual board certified in both pain management as well as anesthesiology. I practice exclusively pain here in Austin. And I'm here after canceling procedures here, moving things over to the afternoon, moving a flight out, upsetting my wife, etc., because I feel a very strong ethical duty, an ethical obligation toward my patients and every other patient in the state, really in the country, to do what's right. And part of the Hippocratic Oath, and I know some of you guys have taken that oath, you guys have also taken oaths of office, is to do what is in the best interest of your constituents, of our patients. And we have a doctor-patient relationship that is imperative. Patients are bringing cannabis in from out of state, whether we like it or not. It happens all the time. People are reading about this. It's everywhere. And patients are asking us questions. And the importance for physicians to be able to communicate with their patients and utilize this in cases where there is no safe or viable option is critical. When we look at how to perform the practice of medicine, we always have to evaluate the risk to benefit ratio. And that's when you weigh how risky is something and what is the potential benefit. Now, I recognize and I respect that there may not be a satisfactory degree of research for certain indications that you guys may or may not want on this bill. PTSD is a great example of this. The risks compared to the benefits with medical cannabis for PTSD is exceedingly clear. But we have other patients too, and this is a reason that the doctor-patient relationship needs to incorporate the ability to be able to choose indications. I have a patient that's dying of Wilson's disease. Who's heard of Wilson's disease?
If you would wrap this up, please.
Yes. The bottom line is I really very sincerely want to ask you guys, and I mean this with the utmost respect, you guys need to do your jobs. Think ethically. Thank you very much. You guys know you support this legislation. You have a lot of pressure to not support this legislation.
Senator Menendez.
Mr. Chairman, very quickly.
Thank you.
You've made a great, passionate, and appreciated speech. But the question is, as a pain specialist, you have the federal government on your back constantly. Your patients have to come in and they have to test for illegal drugs before you can prescribe them pain management drugs. Is that not correct?
That is correct.
Okay. So you can't, when they come in from visiting other states or trying to get medicines, if they test positive for something that's illegal, then you may not be able to treat them. Is that correct?
It happens all the time. Most of our patients are not on opioids, thank goodness.
Right.
But you are exactly right, and it is a huge, huge problem. And it's not just with opioids. I see very many geriatric patients actually that go summer in Colorado and they come back and they try topicals. They get fired from other pain doctors.
They get fired.
And it's not just opioids though. It's Lyrica. It's certain seizure medications. It's ADD medications.
So they get fired from regular medicines because they've tried THC in a legal state. Is that not correct?
That is exactly right.
That's a problem that we have in this state that we can't resolve. Dr. Campbell's original bill spoke to that by not creating these problems. Thank you for your testimony.
I consider this. I really truly consider this to be, I refer to it as a cannabis crisis in healthcare. It is truly affecting healthcare.
Thank you so much. Appreciate your testimony. It's always nice to have other physicians. Things can't get passed with just one vote. You need a body, and it's a deliberative body thinking, and we're trying to make sure there aren't unintended consequences. So I appreciate your testimony. And, anybody who watches a football game, they're going to root for their team and be happy when they at least get a first down. So I appreciate your support. We would like to be able to include so many more diagnoses. This is most certainly a more expanded list, and we will keep working with this. So I appreciate it. And the last comment that we'll have is thank you for your service. Thank you, Mr. Chairman.
Can I just ask
any other questions for this witness? Thank you all for joining us today.
Thank you all.
Thank you. Rene Perez? That was you? Okay. You're still welcome to testify. Chair now calls Heather Fazio, and Ms. Finkel has already... You've already testified. Okay. The chair also goes Mara Rivera, who was not here earlier, and Keith Cook did testify. No, sir. Thank you for joining us today. Would you please give us your name and who you represent?
Yes, good morning, Mr. Chairman, committee members, and Senator Menendez. My name is Heather Fazio. I am the Director of Texans for Responsible Marijuana Policy, here representing our organization, myself, and speaking in favor of House Bill 3703. I have emailed all of you with further remarks. I'm going to keep things brief as we have to, and I appreciate everyone's time and consideration today and the outstanding testimony that has been provided from the people who are living this every day, living with family members with special needs who need access to this medicine. There have been some changes to the bill that I think make it better as far as making it more inclusive. House Bill 3703 originally only allowed epilepsy, MS, and spasticity. I thank Senator Campbell for including more conditions. I do wish that this would be more inclusive, not leaving so many patients behind, and I hope that y'all will consider the testimony you've heard today, the research that's been provided. We provided this binder with ample research on cannabis and its efficacy in treating conditions like all cancers, not just terminal cancer, helping people to beat cancer, not just die with dignity, which is important, but they need that to help themselves get through chemotherapy. So many conditions can be benefited. There is the research has been provided to you. I hope that you will consider it. One other thing with the legislation on a policy standpoint, this legislation still fails to include a critical element of accountability within the cannabis market, which is independent third-party testing. Currently, the only mechanism for these products to be tested is for the company itself to do it, and the integrity of the companies that are operating now is of the highest, and I have no question there. But from a public policy standpoint, we need to have a market regulation through independent third-party testing, and that's not included here. So please consider including an element that allows laboratories to test these products.
Thank you, Ms. Fazio.
Thank you very much for your consideration.
Questions for this witness from the committee? If there's not, thank you for being with us today. Is there anyone else in the audience who would like to testify for, on, or against House Bill 3703? If there is not, public testimony is now concluded. Let it be shown that there are 31 witnesses registered but not testifying for the bill, and no witnesses registered or testifying against the bill. This bill will be left pending, subject to the discretion of the chair.